Welcome, Dr. Raquel Chinchetru. It's so lovely to have you here and to speak about your experience with chronic pain. I think it's lovely that everybody should know you recently completed your PhD, so a little congratulations is due. But you have a history going back for quite a long time, working in the field of mind body health, psychology, yoga therapy. It would probably take up a good half an hour to describe it, but if you could give us like maybe a whistle stop tour, because you have a very extensive background in this area. And I think that that will highlight to people the uniqueness that you bring to the approach.
Thank you very much. And thank you also, Minded Institute, for always being keen and supporting my work as a yoga therapist, as a pain psychologist, and also as an artist exploring different pain conditions and finding different vocabularies of representing pain through art. I guess my work with chronic pain is summarized in one word. Chronic pain is complex. Therefore, complexity, in my opinion, needs to be approached from very different dimensions. I always use a humanistic approach, but also a Renaissance approach. And that's why I want to highlight yoga therapy here, because I think understanding chronic pain is essential. Understand the body, understand the mind, also with psychology, and also understand the spirit of sometimes pain is not possible to communicate. That's why creativity and art can also support that process. In general, as a pain psychologist, but also as a yoga therapy, for me, working with chronic pain is always been approached as a mind-body work. We can isolate, we can work, we can disassociate both sides. We need to integrate. And we just go with the meaning of yoga. Yoga means unison and integration. At the end of the day...
Sorry, just because you have such a background there, could you tell us how you arrived at all of this insight and knowledge? Because before you get into your approach, which is great, could you just tell us a little bit about your background? Because you've got like almost 2 decades of experience.
You mean in yoga therapy as well as...
The whole process of arriving to where you are now professionally, and anything personally that you think is relevant as well.
Yes, well, I start my background with psychology, then I specialize in human resources and company psychology. And then after that, I became a yoga therapist with Robin Monroe and Yoga Biomedical Trust. And that really changed my approach in working with psychology. It was essential for me to understand the work of psychology by understanding the body and the mind and the perspective of yoga therapy. Then I highly specialized in yoga therapy in different settings. I also took Minded Institute training in yoga for the mind and mental health. I also train in Boston with post-traumatic stress disorder and yoga therapy. And I also spent 12 years in women's health, where I explore a lot pregnancy, postnatal depression, menopause, and understanding all the changes in women's life and supporting that. And then I landed into the field of chronic pain because it's always been my passion as part of my sense of purpose to understand human suffering and how we can relieve this experience. And I think I'm very grateful to have done all these previous specialized before, because chronic pain, in order to understand chronic pain, it's important to understand mental health. It's important to understand the body. It's important to understand sometimes the symptoms of trauma, that they can be translated in a pain language. So I'm very grateful to have all that background in order for me to develop a much more deep understanding of how we can work with chronic pain.
And I think, through my insight in working with you and speaking to you over the years and some other leaders in the field of yoga therapy, I've really begun to understand that it is just about suffering. And so understanding how to work with chronic pain through different modalities is essentially understanding how to work with suffering, which is relevant for every kind of client you would see. It really is.
And I just want to highlight the Yoga Sutra that says, even the wiser suffer. Suffering is everywhere. What I'm saying is, we're always exposed by the activity of the gunas that can lead to suffering. And the gunas can be triggered by habits, longing, unexpected changes that can happen to everyone. So understanding suffering is also understanding that it's everywhere, independent of the conditions.
Yeah, and by the way, I know you're super interested, and it was included in your PhD in acceptance and commitment therapy. And one of the things that I love about that is that it doesn't start from the premise that being happy all the time is the pinnacle of the human experience, but rather the acknowledgement that suffering is natural and normal. But obviously, we have a range in which we have to work with. And if it gets too much, that's when we need to seek some kind of therapeutic support. Yeah.
Absolutely. And I think I also want to highlight in this approach a much more anthropological approach, in the
Mm-hmm.
sense that if we come back to Darwin, I think sometimes high level of suffering can lead to survival modes. Yeah.
Mm-hmm.
And if we go an anthropology perspective, Darwin says best people to survive, best animals to survive. It's not the strongest one, it's not even the intelligent one, are the ones that have three characteristics: adaptation, improvisation, and collaboration. And I really want to highlight the last one, collaboration. Suffering need support. Suffering need not doing alone. Suffering is lead to isolation. And what we want to build with yoga therapy, psychology, or my art practice is connection, connectiveness.
Yeah, and actually, right now, that's such a hot topic because the levels of disconnection, even before the pandemic, as a result of the pandemic, and probably also factors not even related to the pandemic, but as society is just becoming more and more complicated, connection is a really big issue. That's probably another piece of this topic, but myself as a yoga therapist, I'm always thinking about not just the intervention, but how can I help somebody to feel internally connected to the universe, but also support their entry into activities that will forge connection, that they feel safe and are meaningful to them. Now, in addition to your work in yoga therapy, right, and you have this extensive background, you work with mindfulness. And my understanding, and please correct me if I'm wrong, is that you kind of like balance them as well as your degree, which you didn't mention, in fine arts. So you bring in
Yes.
that artistic piece um, and psychology. But what are the different values of mindfulness and yoga therapy? And I'm sorry I keep doing this. For some reason, I have an ant that keeps crawling up my shoulder.
No
Apologies to
problem.
everybody watching.
Well, I think in coming from a yoga therapy perspective and intervention in chronic pain, I work mainly with three components: asana, pranayama, and mindfulness. I do believe, in my opinion, I'm big fan of pranayama, as you can see. I think this, in terms of pranayama, there is something very powerful. It's the technique that patients tend not to forget when they have a flare up, when something, they tend to go back and return to the breath. I found that very interesting. And I also experienced clinically that use the pranayama can help with pain reduction. It does can help. And then when we add this value with mindfulness, as we probably know, mindfulness always access more breath awareness. Combining this with breath control techniques, with pranayama, can lead not only to support with pain reduction, can lead also to support with pain acceptance, with anxiety in relation to health as well as pain, but also lowering mood and levels of depression. This is the clinical outcomes I see in applying these techniques. There is a lot of research in the field of mindfulness, showing how much, in which so many aspects can support people with chronic pain. I wish there are more in pranayama, but I do think the combination of both, they can have a very significant effectiveness in the treatment of chronic pain.
Mm. Yeah. And in part, maybe that's because the research around mindfulness and chronic pain started in 1992 with John Kabat-Zinn. So we're talking about more than 30 years for that development. And also the understanding that staying with sensation, which he derived from his own Buddhist experience, does tend to shift how we relate to it and impacts pain intensity and our ability to manage it and improve quality of life. But I agree with you about the pranayama. And you know that that's the thing that I'm also most interested in within yoga therapy. And I feel that there are a lot of clinicians that are starting to appreciate the value of breathing. In fact, like when I went to the doctor recently, they said, just breathe slowly. But they don't know what they're doing, first of all. They don't have proper training. And it would be great if they did, because they could offer a lot. But I think discussing the value of pranayama, both psychologically and any physiological pieces that you want to add in your work and in general in chronic pain, would be helpful for everybody.
Thank you. I also want to add something that you say, pranayama helps physically and mentally, but what I experience in pranayama for pain is it helps a lot with the emotional dimension. Let's
Mhm.
not forget that pain is a physical and unpleasant sensation created by tissue damage, but it's also an emotional experience. And this is demonstrated scientifically as when people have pain, emotional areas of the brain light up. So I do think the use of the pranayama can also transform the emotional processing.
Mm. Yeah, and you know that I'm really interested in neuroscience. And when you look from a neurological perspective, we can't be reductionist about the brain, but this structure, the insular cortex, where we see abnormalities in chronic pain, we see abnormalities in a host of mental health conditions, from PTSD to depression to anxiety, etc. So within that, and I think you're right, the emotional component cannot be underestimated. Like, I remember, to come back to mindfulness, doing intense meditation following a motorcycle accident, actually. And I did an intensive retreat. And I don't know how I bared sitting cross-legged, because it was my knee that was actually crushed in that process. But after 6 days, that was 60 hours in silence, the pain did not have the same intensity or overwhelming experience, because I no longer wanted it to go away. It wasn't upsetting. I was accepting the ability to suffer. But on top of that, what else do you think that pranayama brings on top of the emotional component? How does it do that?
Well, pranayama, coming back what we said at the beginning, brings a lot of connection,
Mm.
connectiveness. I mean, it's about inside, outside. It's the cycle of life. The first thing we do as we are born is inhale. Probably the last thing we're going to do is exhale. It's the cycle of life. And I think it brings a lot of connectiveness, whether the person does individually, but sometimes doing pranayama sessions in group can also enhance even a deeper experience of connectiveness with others and sharing that experience. As you were saying, you have that, but you were in a monastery where there were other people, I assume, practicing, and that also feel quite supported. I think it's important to remember people who has chronic pain, alone, even if they feel lonely, telling them that alone. And I think this is the meaning, is move them from being lonely to be alone. Alone means all plus one. It used to be with double L, and then with the time is, so this is yoga, it's all in one. It's about integrity.
Oh, I love that etymology. I didn't know that. Right,
Yeah,
because
well, you probably know I'm Spanish. It's interesting because in Spanish we don't have that difference. So when I studied English, I thought, why they have this difference? So I studied the etymology of alone, and I think that that goes resonate very well with the meaning of yoga as well, yoga therapy.
yeah, and you can be with other people and be very lonely, and you can be on
Absolutely.
your own and not feel lonely. But of course, the goal is to have both, to be with other people and to feel connected. And the other piece, and I know we've talked about this before, is also the parasympathetic activation, where you move into that shift in the autonomic nervous system. And it's easier to manage almost everything. And the intensity of experience shifts when we're in a more parasympathetic state. Yeah.
Absolutely. And that's something that's why the breath work in pain intensity, I think, is one of the most strongest effectiveness I can say, especially when people having flare-ups and when the pain can get quite intense or severe. Yeah. So it's the use of pranayama. And I think it has something with the hippocampus and memory processing, because
Mm-hmm.
sometimes we need to understand people high intensity of pain can also impact cognitively in reducing memory, attention, perception. So sometimes they know that the breath is always there for you. You can access that resource all the time. So sometimes they say, Raquel, I didn't know what to do when I was having a flare up, but I remember the breath. So just engage with the breath.
Mm. And as well, we have the memory of the experience of chronic pain. And when we enter a more parasympathetic experience, those signals that are being sent up, we can process them in a different way rather than taking former memories, overlaying it on top, and making it more difficult overall. You mentioned before, about how also it creates connectedness, and there are various different ways you can work with pranayama. One of the things that actually I learned from you, because you are creative, that I think is really interesting for people to consider is you said to me once, pranayama is one of the most effective tools I have. But for people with extreme chronic pain, they cannot or they don't feel safe enough yet to inhale and feel the sensation and exhale. So I actually have them inhale, and you can correct me if this is the wrong thing, from a point on the wall and then exhale back to it so that they're not bringing that sensation internally. So this is sort of a two-part question. One is a little bit more about that. And the second is that because you are an artist and a creative, how that influences your work. Because it is very unique to have a background in psychology, fine arts, and yoga therapy.
Thank you. Thank you for value. But sometimes, Heather, the more you know, the less you know. So I accept that as well. I mean, I do think being a fine artist helped me immensely in develop creative and innovate methods in working with chronic pain. Because sometimes you get, for example, a lot of people with long-term COVID, extremely difficult breathing situations with even no diagnosis, but also pain. I've been seeing a lot of cases also with severe abdominal pain, where actually engaging the diaphragm is painful. So you need to develop creative ways for them to be able to engage in the process of breathing. Maybe, as you say, I use a lot of visualizations. Sometimes I use, thanks to my projector, and I can put images that give them safety, and that we can start promoting the breath in different way. So I think that helps me immensely in develop interventions that are always unique to the patient, and how they can engage. I remember one patient having severe COPD, but he used to be a diver when he was younger. So I put some sounds, diving sounds, to connect with that experience. Because in diving, you need to have a lot of breath control. And automatically, that helps him to begin to breathe deeply. So sometimes adding that creativity helped me. Additionally, being fine artist helped me massively in my yoga and psychology practice. As we will talk later on my research, it's also complex to work with chronic pain. So having my space as an artist is the platform. It gives me the resilience, the strength, but also the commitment and motivation to carry on doing my work as a psychologist or yoga therapist.
Mm. And I think that it doesn't come up enough necessarily in yoga therapy trainings, but because yoga therapy is person-centered, creativity is important. Now, you are naturally given to that, but I think that it's important that people in general are experiencing some level of training in that so that when you have a client and you're not sure how to work with them, like you said, with the diving. I remember you used to do soundscapes and you'd call it the island of sound and safety, and you had like 1,000 different soundscapes.
Yes, I got
And
it
the
in the
British,
BBC. There was a
yeah,
sound library, and I was fascinating of a
yeah,
sound library. Yeah.
yeah. But I think that the creative part in yoga therapy trainings is important. And although you're talking about so much more in the training that you're delivering, this is also something really unique that you bring to the table. And I just have to tell people because I'll never forget it, and it really made me laugh, but it was also brilliant, where you had this client who was extremely resistant. And because you work in the NHS, it's not necessarily people that want to work privately, and they may have resistance. And this man didn't do anything. And you asked him, is there anything he liked? And he said, Ferraris. So you were like having him breathe. You remember this? Breathe in 1 Ferrari, 2 Ferrari, 3 Ferrari. And he went out to reception and he said, I love that Ferrari breathing.
And we ended up doing a Ferrari meditation practice. It worked for him. Yes. I forgot about that. Thank you for reminding me that. Yes.
Oh, yeah, that was always a great story. But
I
yeah,
mean,
so Sorry, continue.
Ultimately, creativity is essential in chronic pain. Yeah. And I always encourage my clients also when I train healthcare professionals, apply creativity, but also for yourself, because we cannot communicate pain in the sense that no one can feel your pain for you. Therefore, the only way to express that is through creativity, whether it's writing, singing, dancing, sculpture, painting. In fact, if we look back to the history of art, the most powerful art pieces, they always talk about pain and human suffering.
Yeah. And it's a way often that we process it. Yeah. So, speaking about your dissertation, your thesis um, on chronic pain, do you want to tell us a little bit about your research? And I know it goes above and beyond yoga therapy, but also maybe linking it back to how people that may want to train with you can understand the overall value of your offerings.
Yeah, well, I do think both research that I did, the qualitative study and the systematic review, they both have a lot of implications for yoga therapists as well. And in
Our
many
audience might not know what those two things are. Just in case they don't, you want to define what qualitative research and systematic reviews are, just to make sure everybody knows.
Yes, if you want, I can start with the qualitative research, because also can go very well with yoga therapists and healthcare professionals, and then we do the systematic review. So a qualitative study, sometimes you have quantitative or qualitative. Sometimes the qualitative study can have much more small number of samples than other in quantitative, but you look at more in depth in doing semi-structured interview when you want to understand deeper a particular theme that you want to interview. In this particular study, I have 6 healthcare professionals. They work in the field of chronic pain. So the study was understanding the work experiences and provider perceptions of working in the field of chronic pain. And I interview 3 physiotherapists. In a way, people that work more in the physical aspect, and I know that can also be related a lot with many yoga therapies. And then I work with psychologists, and I interview 3 psychologists, pain psychologists. I have to say that most of the qualitative research in understanding provider perceptions is always being done more in nurse population or even medical doctors. And I thought, well, let's hear, and also some physios as well, physiotherapy, but very little in pain psychology. Sometimes you get perceptions in clinical psychology, but not necessarily in chronic pain. That's why I thought this research can bring a lot of understanding about what are the providing needs and difficulties, and how we can ultimately improve chronic pain services by understanding what are the clinicians' interpretations of burnout, what are the future career aspirations, and ultimately how we can support the delivery of pain management to a healthcare professional. The main aim I did is to support patients with chronic pain, but my approach was, even if you do a lot of research, you spend a lot of money, study the best methods to support people with chronic pain, if we don't look after healthcare professionals, all of this is gone. All of this is gone. And I think this is a plea to value, but look after immensely healthcare professionals. So when I did this,
Oh,
sorry?
sorry.
No,
I
no, no.
was just going to say, and this is so important in the NHS right now because we have people leaving in droves. And, some of the techniques that you're teaching are not just relevant specifically for people with intense chronic pain, but I really think, and I believe that you would agree, they should be incorporated into their own training for themselves. And also that embodied experience will help them. Yeah, but sorry for the
No,
digression.
absolutely. But I want to say the meaning of doing this research for me was improve services in pain management ultimately, but also highlight how important, how relevant is to look after healthcare professionals. The same value we can apply in yoga therapy. If you are a yoga therapist that want to work chronic pain or PTSD or any area you want, it's so important to look after yourself. So that's why I did it. I'm just going to mention the 5 relevant themes that I found as a conclusion. I also send you the summary in case people sort of want to see more. And I found fascinating doing this research. Qualitative research can be endless process. There was a moment that I thought I want to carry on interpreting. I use interpretative phenomenological analysis, and I found it fascinating. I found 5 themes. First one was emotional dimensions of working with chronic pain. So conclusion is working in the field of chronic pain can be emotional taxing. In another way, you pay the bill if we don't look after ourselves. And then all these emotional taxing dimensions were applying different themes. So I found some sub-themes like ramifications of complexity, how much the complexity of chronic pain patients as comorbidities can influence the treatment. Also, how different job roles can impact in the emotional processing of working in pain. So, for example, many people have admin roles or manager roles plus clinical roles. And that can also have different emotional implications. There was definitely reporting many participants a negative emotional landscape in working with chronic pain. And there were common ones like frustration, overwhelming, pressure, anxiety, and stressful. They sort of all experience different challenges in working with chronic pain, such as coming back to comorbidity or patients expecting for you to get rid of the pain. And then there was work satisfaction can be fluid. It is definitely that working in the chronic pain field is vocational and requires also a commitment, but ultimately is vocational. And that work satisfaction can be fluid. So it can be very frustration, pressure, but at the same time can be very rewarding as well in working in pain. Then the second theme was life values for working with chronic pain. I just thought use value coding in qualitative research was very interesting because when you work with value coding, you get the essence, the heart of what is in the message, the participants lie on that. And the life values in working with chronic pain, I found them fascinating, was empathy, active listening, and then I use workplace experiences because active listening and empathy was present in all participants. But then after that, some participants start adding individual ones that I thought this is interpretative phenomenological analysis. We need to highlight the individual as well. So they were very interesting, adding different values such as self-care, self-preservation, resilience, adaptation, commitment. So all sort of different values that were important in working with pain. Another theme that was present in these interviews was how they can build the therapeutic relationship. Again, this theme is very relevant also in the use of yoga therapy. At the end of the day, yoga therapy is patient-centered, yeah, or client-centered. So it's like how we can build that relationship. Again, if we don't build that relationship, you might have all the knowledge, all the resources on the world to work with chronic pain, but without communication, everything will go away. So what building a therapeutic relationship components are found in this research was having previous experience in chronic pain, enhancing communication skills, essential, such as listening, feeding back, but also reflecting, you know, in the process of communication also involve the process of reflection before and after, and empowering an active role in the client. That I think that also goes along with the values of yoga therapies, yeah, or mind body therapies, or mindfulness, or pranayama teacher. And then I also explore, and this is where I think this study can also contribute to improvement. What are the barriers or the obstacles in working with chronic pain? And that was fascinating. That was present in all the participants, managing expectations from the client. Can I get rid of the pain? Can I live with that? Also, some participants mentioned managing expectations of my professional role within my team. That's also very interesting, especially sometimes when a patient can be very complex and they move in different professionals. Another part that's essential is lack of management support. I think there is a lot of studies during COVID when people were, especially healthcare professionals, overworking hours, not having the management or even the social support by others, how much that was influencing the burnout. I put another thing and I call it race against the clock, because that is something that encouraged how many all the participants told me, like Raquel, especially in physiotherapy, like seeing one patient back to back after that feels exhausted, overwhelming. And also doesn't enhance the process of communication because it doesn't give that time also for reflection. Another thing that I found it fascinating, and it came out of all the participants without inquiry about that, was the impact of COVID and working remotely. How can impact in, I need to adapt in moving online or working over the phone or working on the face to face, sorry. So that can also influence. And then I found it, what are the protective factors?
So Raquel, I'm sorry. We have to move also on to your systematic review, but
Okay.
I think what you're providing here, is there a place that people could actually read your dissertation, the qualitative research, sorry, it's thesis. I keep saying that because in the US it's the reverse.
Yes.
For your
Yes.
for your PhD dissertation. Yeah.
I mean, what I do is I provide you today with the very good summary of all the research and reference. And then when I do the observation, I think it's in August, in working with chronic pain, I also going to add there a PowerPoint in explaining more deeper in details all the researchers. So more than happy to forward that to you, and people can also see that if it's okay.
Yeah, or maybe a separate, like an entire separate piece about your research.
Okay, yeah.
I think, yeah, because actually I think during that observation, they're just going to want to know, why did you ask these questions? But you could do a separate piece and they'd love that. But
yeah.
Maybe
Probably I agree with you. I know we need to move, but separate piece, we can discuss that because I think it can be interesting. I just want to mention, because this is super important in yoga therapy, the last thing was protective factors. And I think this is what we need to listen, was feeling supported by the team, multidisciplinary approach to learning. This is essential, how we can support healthcare professionals in the process of learning, having supervision, and the flexibility of working. I think that comes from COVID. Like some people like to work online, work face-to-face, and have that flexible approach. Thank you. We move now to systematic review.
Fantastic.
So another aspect for me of chronic pain is I'm passionate about supporting people in opioid reduction. We all very aware here that there is a massive opioid crisis worldwide. And it's still very little evidence to understand what actually the efficacy of interventions we can do to support that. So I did a systematic review. Systematic review is a secondary part of research. It's still a research piece, but you don't need participants. All you do is you research about a topic, and then you begin to review that topic systematically to draw conclusions. So in this one was to evaluate the efficacy of psychological interventions for opioid reduction and psychological outcomes in people with persistent non-cancer pain. So I did a systematic review. I follow databases such as PubMed, Medline, and PsychoInfo. The initial criteria when I select all the abstracts for inspection was 9,000. And from 9,000, I select 8 studies in which the source on evidence in psychological interventions can support in opioid reduction, but I like sort of to mention more. It's a very also new field, and there is more research that needs to be done. Yeah. What I found fascinating is the conclusions from all these 8 studies. Yeah. So 5, what I did is both studies have to have outcome measures in opioid use as well as in psychological outcomes. Yeah. 7 of these 8 studies saw improvement in psychological outcomes, and 5 of these 8 studies saw improvement in opioid reduction doses. Yeah. The conclusion in terms of intervention that shows some evidence from psychological perspective to opioid reduction was mindfulness. I think, again, coming back to yoga therapy, we can see how important that is. Commitment, acceptance and commitment therapy, compassion-focused therapy, as well as cognitive behavior therapy and motivational interviewing. However, I think there is some evidence from this review that psychological interventions can help to opioid reduction, but also to opioid use disorder, because I think this is ultimately something that I want to target here. However, from the review studies, it's still difficult to establish the effectiveness of psychological-based interventions when referring to opioid reduction. We need much more studies with high-quality studies with adequate more site samples as well as methodology. But this is the first systematic review that look at two psychological interventions for opioid reduction, independent of the duration. There was another systematic review about brief psychological interventions, but this systematic review looked to all the interventions independent of the duration of the intervention, that I think also bring a lot of value about when I did the findings.
So, okay, so a really important addition to the field, and like you said, more research needs to be done, and maybe you will be involved in that. I know how much work it is to be involved in research. It's not easy, but I wanted to come back to the course that you're going to be running. And just, there are a lot of training these days on chronic pain, yoga therapy, and mindfulness, but I have always found your approach really unique. So could you just give an overview as to what people will learn from you and also what they will uniquely learn from you?
Well, as you know, I wrote a manual with all my passion, and I love to train healthcare professionals and support them. I think what they're going to learn is a very good approach in working with chronic pain from asana, pranayama, mindfulness. And I also, as you mentioned, I add this chapter in acceptance and commitment therapy for emotional regulation in working with chronic pain. I think at the end, what they're going to be is to learn to be the best chef. What I mean is, I always say to them, I'm trying to give you the best ingredients possible in working with chronic pain. And then it's also your art of being a therapist to know how you can apply them to the individual needs. I think the course is very strong in approaching asana practice, but not from different conditions. There is more than 400 conditions in chronic pain. We cannot decide 400 sequences, and also there's a lot of comorbidities, but they will understand a very good base of how they can approach the body, even if having chronic pain, from different perspectives. I do sequences from yoga for the eyes to even sequences in yoga for the face, and sequences for back, and so they can merge that level of working and establish a different relationship with the body in working with pain. It's also very strong in pranayama techniques. They will learn different ones to apply in different contexts of chronic pain. And it's very, very deep, I think, in mindfulness. I designed 8 weeks of mindfulness. This is more like a matrix approach. So rather than follow one by one, it's about understanding deeply in order to how they can be applied in different rhythms with the client. I also want to highlight that ultimately this training is highly experiential. It involves experience and learning. So for me, it is essential that people work with their own pain, independent they have chronic pain or not, as a therapist, in order to work with others. And that's why many people of my training is not about just the knowledge, it's also about the experience they get of the training.
And I think that the other piece that you haven't added is the wealth of experience that you have from so many years of seeing so many patients. And also that you were, to my knowledge, the first yoga therapist to work in the NHS for chronic pain. And the entire intake procedure that you engage in and the thoroughness that allows you to determine how to work with the client is unique, which is why I've asked you to do an observation on August 13th just on intake, because that in itself is really important. Truly being able to listen to the client from a multidimensional perspective with years of experience. Because, as you said, pain is so personal. You cannot experience somebody else's pain. So, Raquel, it's been really lovely hearing from you also about your research and your background. And I hope that people join in your course, because I know that the former students from the Minded Institute that do it as an elective and externally have raved about it. I wish I had time myself to take it.
You're always welcome. And I want to say thank you for Minded Institute for always believing in my work. Thank you so much. And supporting me in delivering this creative and innovative approach. I will always be grateful to that, because thanks to that, I was able to meet different students that ultimately can support people with chronic pain. So thank you.
Wonderful. Thank you. Namaste. Take care,
Namaste.
everyone. Thank you, Raquel.
Thank you.